Now more than ever, innovative technologies are fueling change and sparking new ways of thinking. Collaboration between corporations and startups is key to staying at the forefront of these trends. However, finding the right startups can be expensive, time-consuming, and ineffective. But Plug and Play is here to help. As a corporate partner, you will gain access to a whole ecosystem of innovation. Discover startups that meet your tech interests. Stay updated on the latest trends and network with industry peers. We will help you during every stage of your innovation journey, no matter where you are and where you want to go. Get in touch today.
Good morning and good afternoon to you all. My name is Nathan Stunheimer and I lead U.S. healthcare partnerships at Plug and Play. We're so excited to have you here today for our Advancing Health Equity event. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. It requires removing obstacles to health, such as achieving quality education and housing, safe environments, and comprehensive healthcare. Across the nation today, gaps in healthcare are large, persistent, and increasing. Take healthcare access, for example. You need a doctor or another provider close enough for easy travel, which is not always assured. You need health insurance or another way to pay. Adults need time off work, and patients who speak English as a second language may need interpreters to assist at medical visits. Truly, the list goes on and on. So it's really not enough to be a hospital or an organization that can provide world-class care. We must actively help people receive that care. We can achieve health equity when every person has the opportunity to reach their full health potential, and no one is disadvantaged from achieving that potential because of a socially determined circumstance. Health inequities are reflected in multiple ways, such as length of life, quality of life, rates of disease and disability, and access to treatment. Shockingly, health inequities lead to approximately $93 billion in excess medical costs per year. So this conversation today could not be more timely. So today, we're very excited to feature a robust panel with representatives from Roche, Hartford Healthcare, and Wellstar Health System, where we will discuss trends and applications of technologies that remove barriers of health equity, followed by live Q&A. After our panel today, we will feature two incredible startups, Kaizen Health and LiveChair Health, who will share case studies on how they are scaling their solutions and driving meaningful change in care access and health outcomes, thereby moving people and communities towards complete health equity. We will then wrap up with a very special announcement that will be taking place next month. And so please stick around and stay tuned to learn more. So let's get started. Before we hop into the panel, I'd like to give a quick overview about Plug and Play. So we are the world's largest innovation platform in the world and one of the most active VCs in Silicon Valley. We connect the world's best startups with national and international corporations to help them bring technology and innovation to market faster. We do this in almost every industry worldwide. And when it comes to healthcare, we specifically address the needs to enhance care delivery and improve the patient experience and outcomes. Our platform has three components: startup acceleration, corporate innovation, and venture investing. When it comes to accelerators, Plug and Play runs 60 accelerator programs worldwide in 38 countries. The programs are run on behalf of our corporate partners who collectively choose the startups to enter 12-week programs. We accelerate over 2,000 startups each year, and we have over 45,000 startups in our network. When it comes to corporate innovation, we assist our corporate partners in their open innovation efforts, helping them scout, discover, and test drive the right startups that can enhance their ability to innovate and find new revenue opportunities that advance their business. And we do this for over 500 Fortune 1000 companies in 18 different industries. And lastly, we are investors, and we're one of the most active investors in Silicon Valley, investing in over 200 startups per year. We focus on early stage, seed, and Series A global startups, and currently have over 30 unicorns in our portfolio. And so without further ado, let's head over to our panel. Today, we are so thrilled and thankful to have such a robust panel for our discussion on advancing health equity. We greatly look forward to discussing trends and applications of technologies that remove barriers of health equity by increasing access to care, reducing the burden of disability and disease, and improving mental health so that every individual has a fair and equitable opportunity to achieve a healthy quality of life. So today I'm proud to introduce Keith Grant, Senior System Director for Infection Prevention at Hartford Healthcare, Samir Assad, Medical Access Partner at Roche Diagnostics, and Julie Tier, Senior Vice President and Foundation President at Wellstar Health System. So Julie, Samir, and Keith, welcome, and thank you all for joining us today.
Yeah, thank you. Looking forward to the discussion. Thank you for having us.
Absolutely. So just to get us kicked off, it'd be great just to start off with some introductions. So I'd like to start off with you, Julie. Do you mind just telling us a little bit more about yourself and just give a high-level overview of what you're doing at Wellstar?
Sure. So for me, I kind of live my life by a rule and some advice that my mom gave me, which is if you have your health, you truly do have everything. And I really think, that rings true for everybody, no matter who you are, where you live. And that's where I've been really proud to join Wellstar Health System just under 2 years ago to help build a transformational foundation to help us address many of the issues that we'll be spotlighting today around health equity. Prior to joining Wellstar, I spent 8 years as the Chief Development and Public Affairs Officer at Boys and Girls Clubs of America, and spent time at Susan G. Komen for the Cure. I always like to share that's where I got hooked on the belief of the essentialness of philanthropy in terms of really helping us develop solutions to the significant challenges that we face, because they are there. And I saw that firsthand at Susan G. Komen for the Cure. And then spent half my career, I usually like to say half, but to be honest, it's now a little bit less than half the older I get in national politics. So been up close and personal with a lot of the policy work as well. And glad to be here today.
Oh, awesome. Thank you. We're happy to have you. Keith, I'm going to turn it over to you.
Yeah, absolutely. My name is Keith Grant with Hartford Healthcare, Senior System Director in Infection Prevention, also epidemiology and infectious diseases as well. Provider, although to be honest, I rarely see patients as much as I'd like to. Also a member of the U.S. Air Force. I've been so for the last, I'd say 17 years, delivering care in many deployed locations. And at Hartford Healthcare, we have a significant commitment to the community. We're very much embedded in Connecticut in many ways, in many communities that have certain needs. And over managing COVID-19 response, I've had the opportunity to work with many leaders, not just within Hartford Healthcare, but throughout the community. And there's much we've learned, and a lot of it we're going to discuss today.
Awesome. Thank you. And Samira.
Thanks so much. And thank you very much to Plug and Play for having me today. And for those joining us or able to join us today, my name is Samir Assad. I'm the Medical Access Partner for Roche Diagnostics Corporation. And ultimately, kind of what brought me into industry was wanting to make a more broader impact across all patient lives in terms of improving health outcomes. And that's what I work day in, day out trying to do, work as this bridge internal liaison, kind of living in the medical, with the medical team, and then also serving to liaise to the access end of our organization, a position that really aims to generate evidence and really translate the value story of our diagnostics to payer and policy stakeholders so that we are able to bring it to broader populations. So I'm looking forward to the discussion today and to taking part with Keith and Julie.
Awesome. Thank you. So to kick us off, one thing that we've learned is health equity takes a lot of shapes and forms in a variety of different communities. And so I'd love just to level set with the audience. And I'd love to just dive into just understanding what health equity actually means to you and means to your organization. So Julie, I'd like to turn it over to you to kick us off.
Sure. Well, for me personally and at Wellstar Health System, and it really is a big reason why I joined this organization, is it's really at the core of everything that we do. At Wellstar, we play the role as one of the largest integrated health systems in the state of Georgia. And at the core, we believe it's more than healthcare. It's really all about people care, and that every person should have access to the right care at the right time in the right place. And we're also a very unique system in that we serve very urban communities, suburban communities, and some of the most rural and medically or otherwise under-resourced communities in the state. We are a nationally and locally recognized leader in clinical excellence and innovation, and at the same time play the really critical role that we're very proud of as the state's largest safety net health system in the state of Georgia. In fact, Modern Healthcare just listed Wellstar as a top 10 provider of charity care in the nation. Also in 2019, as a part of the community health needs assessment that was conducted, which really gets at the leading social determinants of health facing communities and people living in those communities, and what we can do to better help address those in partnership with the community. So Wellstar established, which is the only in the state, dedicated Center for Health Equity to really help bring about community-based solutions to those challenges.
Awesome, thank you. And Keith, I'm going to turn it over to you.
Yeah, I mean, has this definition changed at all since COVID-19? It's a good question. It's a question that we've been grappling with over the last few months. But I think, Hartford Healthcare is, as Julie stated, both health systems are positioned in communities that are very diverse, with very rich diversity. And we're very well positioned from a voice, from a resource perspective, in order to, one, analyze the data as to how health equity does exist, two, appreciate our presence in delivering care in a way that is more equitable, right? I can tell you, I'm a numbers person. As an epidemiologist, I know that's what I do, is about numbers. And we've appreciated the use of numbers even more. I can tell you, there's a study that came out a few years ago, and within that study, it looked at two separate communities, it's West Hartford and Hartford, which is separated by mere miles away. And within that community, I think, there's significant diversity that exists in one community and one not so much. There's a difference of about 17.8 years in life expectancy between both communities. That's an alarming number. Now, there's many numbers that go around that lead up to this, and I'm sure we're going to get into that. But I think health equity to us, and Julie started by saying, life, and I would add hope to it, is probably one of the most important gifts. And it's our job to ensure that individuals are maximized on both of those.
Great, thank you, Keith. And Samira.
Yeah, I guess from my vantage point, especially working in an organization like Roche that works to bring new innovative solutions to the forefront each day, health equity means living in a state in which the unmet needs of all patients, including those that are living in underrepresented communities, are able to be met, and that they're able to access our medical value solutions, and those solutions serve as a bridge to the gaps in disparity. In a large way, having an opportunity to access our medical value solutions, whether it's a test or a therapeutic agent or a digital solution, with the same potential to improve health outcomes from one community to another, that's how I view health equity. This really relies heavily upon a concerted effort to really engage these populations in more enhanced inclusive research experiences, which look to bring diversity to our clinical trials and provide better results overall, which can be applied more broadly to the population. And this also means working to address some of the challenges of reaching those populations, whether it be because of the remote geographies or their inability to travel to clinical sites, or health literacy levels that may not be the same or might be varied, implicit biases amongst clinicians, or overall mistrust in the system as a whole, which we recognize and are really making incremental strides to attempt to improve.
Awesome, thank you. And the thing is, and as we all know, health inequities have been a serious forefront issue across the country. And the COVID-19 pandemic really highlighted the severity of these issues and challenges, as you mentioned, Keith. But sticking with you, Samira, and really kind of sticking with the theme of evidence, can you share with us how you are leveraging evidence as you strive to improve health equity in the communities that you serve?
Absolutely, absolutely. So really working to leverage data in a way to better address the unmet needs of all communities. And this means taking a real in-depth look at the disparities that exist across disease areas and shining a light on which prevail related to demographics, related to outcomes, and to overall health. The pandemic really shined a light on some of the stark disparities amongst patient populations. However, those same realities existed well before the pandemic. And oftentimes this means better leveraging data to really understand what's happening at the grassroots in order to better understand the key drivers of disparities. Is it simply an educational gap? Is there a need for a change in clinical practice? Is there a lack of enrollment of specific communities within clinical trials? This allows us an opportunity to really be able to generate that evidence, to find appropriate patients for selection, which leads to improved outcomes and really enhances that inclusive research experience. And then even beyond the pandemic, we know that there are some external dynamics that are also quite at play. There are considerations for organizations like regulatory bodies, like for instance, the FDA has now provided guidance on the need for better patient inclusion in study design and recruitment. And so just another consideration for us in terms of how evidence is shaped in such a way to ensure all patients are really represented.
Great, thank you. And Keith, I'm going to ask you the same question. How are you and Hartford Healthcare leveraging evidence?
Yeah, so one of the things that we looked at and we have spent a lot of time and resources on is the question as to whether or not we're collecting the right information. Are we giving the patient the opportunity to express their feelings, to express their belief about how care should be delivered? And where is that coming from? What neighborhoods is that coming from? What communities those are coming from? So we've enhanced our EMR, so our electronic medical record, in order to capture certain data that's more specific on age, race, ethnicity, and certain other data point. That's been very, very helpful. The other thing that we look at is partner with many communities across our state in order to be educated by them. There's a time when we look at education coming in from one way, right? So the health system goes in and we have this forum and we educate the community. We're learning more about what the direct needs are, and we're capturing data from that as well, and we're shifting and addressing resources accordingly. The other thing that I will say is what have really a lot of pivoting has done since this pandemic. And you're right, the pandemic just outlined, Samira mentioned this many times, the pandemic really just outlined, it highlighted deficiencies that were present before. So we're being very, very meticulous in capturing and extrapolating data from what we've learned from the pandemic and how we've managed and collaborate with the community during the pandemic today.
Great, thank you. And Julie, I'm gonna ask you the same question.
Sure. So I, just echo everything that Samira and Keith said, and maybe just add here at Wellstar, we too are really working to understand what the data is telling us as a health system that's serving 1 out of 6 people in our state of Georgia in very diverse communities. A lot of times we have so much data, and it's really getting at what is the most important data that's going to help us understand how we're able to best improve the health outcomes of the people that we serve. And every program that we may develop or deploy being evidence-based is really driven by what I'd shared in one of the earlier questions around what our community health needs assessments are telling us. So we just completed our 2022 Community Health Needs Assessment in partnership with the Georgia Health Policy Center, where it's really surveying and getting not only what Wellstar consumers and patients are telling us about their experience, about what their health challenges are and what they need, but also the broader community, because we know no one organization can solve these challenges alone. And so that really drives the areas of focus for us in terms of access to care, food insecurity, maternal and child health, housing, and poverty, right? All of these things, and this is what the data is very clear about as well, they don't live in silos. And so if we're really going to have transformational impact in addressing them, we're going to have to de-silo and come together to really have solutions and programs that address them effectively and holistically.
Fantastic. And all of you really alluded to engagement and access. I'd really like to transition from evidence to that specific topic. So, the big theme of access is really thought of in terms of population accessing healthcare, but also we really need to flip the script and really say that healthcare needs to access the population. So what are you all doing to reduce the access gap and drive consistent engagement with those communities and the folks in those communities? So Keith, I'm going to ask you that question first.
I mean, how much time do we have, right?
Very true.
So, firstly, appreciating that it's a huge problem. So it's a significant problem. So we need to redefine access. And you I think you did a wonderful job in stating that, in that the traditional belief is if I build it bigger and I create more buildings and I have more marketing, then patients will come, right? And we're beginning to realize that that's not the case. That's definitely not the case. So we've had many conversations regarding, why is this not being accessed the way it's supposed to be? So one of the things that we're doing, again, is just an appreciation of data, right? I can talk to you just about a few things. And one thing is we've worked very closely with a company, a startup company that has done a wonderful job in creating a platform for us to communicate with our patient in a different way via text message, for example, in communicating with, the availability of appointments, the availability of vaccines, and the availability of different educational forums, so to speak. We've worked very closely with, our media team, for example, to reach out and again, try to get the right information out in a timely manner. We've also worked very closely, again, with our community members and community leaders as we try to leverage, these are technological platforms, this is the technology we have available. How do you guys want us to do this better? Or how is it that we can be better as a system? I mean, again, we can keep going, and I'm sure Julie, the same with the work, Wellstar has done. Hartford Healthcare within the community of Connecticut has worked very closely with the community, appreciating our magnitude and our impact in the community. But again, there's so much work left to be done.
Yeah, that's fantastic. And Julie, I'm going to transition it to you.
Sure. So like Keith, at Wellstar, we really do believe, in part of our, core of our work is that, when we talk about people care, it really means that the care that we provide our communities extends far beyond the walls of our hospitals or our health parks or our physician offices. And as we think about health equity, and in particular addressing, what I think is core, just access, right? Access to the right care at the right time in the right place. We're going to have to meet people where they are, right? So at Wellstar, and really through support from philanthropic donations, we were able to launch what we call our Wellstar mobile markets, as one example, in partnership with an organization, GoodR, where it started in all of our communities. We would have a mobile market where people could come and grocery shop with dignity and have healthy options. We've now expanded that to where we've brought in another partner, Wholesome Wave Georgia, so that when families or people are coming to the mobile market for food, they then have a dedicated navigator that's helping them navigate and understand what are the benefits that they can access to help make that healthy eating a more sustainable and habitual way of their life. And now we're expanding those mobile markets to have wellness clinics as well. So as we think about behavioral health, and just, I don't think Georgia is unique, just a huge gap in behavioral health care, mental health care services across the state. We've also, and I'm sure, Keith, you all see this a lot too, where because there's not access to the right preventative or primary care, or people are uninsured or underinsured, the only option they have is to go to the emergency department for non-emergent needs. And so we have piloted a navigation program in some of our emergency departments, where if a patient is coming in, but really they need primary care, or they need help with chronic disease management, they have diabetes, or they have hypertension, or they have behavioral health needs, that we're able to then, with that navigator, connect them to the right care in the community through our health system or through another partner. And we've seen significant reductions in the number in a couple of our facilities of people that really are using the emergency department for that primary care and connecting them with the right care. So certainly more to do there, but I think, at the end of the day, we've really got to extend the care beyond our walls, meet people where they're at, and also really start to think innovatively about how innovation and technology, which I think many of us really started deploying at a much greater level during the pandemic, is now going to become core to how we think about shaping and delivering healthcare, now and into the future in a way that is consumer centric and people focused.
Fantastic. And lastly, Samira, so what are you and Roche doing to ultimately drive consistent engagement with these folks?
Yeah, just piggybacking on that concept that Julie kind of mentioned of meeting patients where they're at. We really recognized, especially through the pandemic and even prior to that, that it's important to have decentralized approaches for especially our remote patients that live in kind of middle of America to be able to reach. And technology does a great job of doing that. And so does having appropriate infrastructure when it comes to laboratory testing, for instance. So changing that profile of the centralized testing mechanisms whereby a patient had to commute to the lab, instead bringing that into their home, bringing that to the point of care space, and being able to kind of leverage the test results that they provide, or doing the same in the space of conducting trials and clinical trials and having those decentralized approaches in that space as well. In addition, we are really allocating a lot more resources to listening more intently to the voice of the patient. And there's a strong communication with patient and patient advocacy groups where there is an effort to smooth out the kinks in the patient journey. And this might be related to implementation of digital solutions. We know that data interoperability is always an issue, and we recognize the patient journey is not always a seamless path, and it's often layered with a multimodal approach to management of a disease state, not to mention those extrinsic factors that may contribute to poorer health outcomes. So we really look to optimize upon that journey in the hopes of easing the path for all patients.
Fantastic. And thank you, Samira. And so, Julie, you mentioned before, and I completely agree with the fact that it's absolutely imperative to meet patients where they are located. And as we all know, however, to truly augment health equity, we really need to leverage the communities around them. And so, Julie, I want to ask, have you previously mentioned these community-facing interventions? Can you touch on what that entails and discuss how community partnerships should be leveraged? Excuse me.
Sure. So one thing that we did at WellStar to that point a couple of years ago through our WellStar Center for Health Equity was actually launch a challenge, if you will, to our communities. It's called our Community Transformation Program, where it's essentially and I call it an RFI, a request for ideas, on some innovative ways that, in particular, I know we're talking about technology today, that we could leverage technology to help address whether it's gaps in access to care, or things like in Georgia, where we rank 50 out of 50 in maternal deaths, in particular Black maternal deaths. So one program we call Operation MISS that we do in partnership, and it's essentially getting technology out to women during their pregnancy, where they can actually monitor, if they have diabetes or hypertension, they can monitor their heart, they can start to educate and use technology to help monitor their condition so they know if something spikes, right, it's time to call the doctor and not wait until you're actually, giving birth. And this is an area where we're just really scratching the surface, and I think tremendous opportunity for technology in our community to really come together. I'd say the other one that I would highlight, and if I put my old hat on around youth, and if we think about just the health of our communities, our states, and our nation, it's really, we can see it by how we're setting up our youth to be successful and healthy in life or not. And so we actually was out in West Georgia, which is a more rural part of the state, yesterday in LaGrange, actually, where with our pediatric service line, we actually launched mobile clinics in a local school. And so if you think about in this particular community where maybe parents are working, full time or multiple jobs, and young people, they may not be able to get to the doctor if they have something that might be a cold or might be. So we launched a mobile clinic in this particular school. Over 700 families came out for the opening and gave consent for their child to be seen by a WellStar pediatrician should the need arise. And I think it's being innovative more with how we can bring, the healthcare and more on the preventative and wellness side of things into our community and where people are at. But I think also to this, what's really critical for these programs to work and be sustainable and scalable is they have to be done with trusted partners. So we work very closely, whether it's the schools, it's congregational health networks, it's other organizations like American Heart Association or American Diabetes Association. And one other one I would highlight, I think oftentimes too, we can think about these issues and maybe because the magnitude of them is so great, but when we think about housing and we think about health and we think about education and we think about economic mobility, all of those are so interrelated and interdependent. And so as we're working more and more to kind of what I'd say, do Uber community collaboration and partnership, it's really how we're tying all of that together. So one example I'll give is a partnership that we just launched with the Urban League of Metro Atlanta. You might say, well, what are the Urban League and Wellstar Health System doing together? So when we think about, I think, Keith, you're living this every day too, the massive shortages of nurses that exist, right? And other key frontline roles that really are, on the front lines of helping foster the health and well-being of our communities. So workforce and urban leagues, focus around economic mobility. And when we think about health equity, having a diverse and healthy healthcare workforce in our communities is critical. So we launched a workforce development program that gets at both health, but also employing more members of the Urban League community into our critical nursing roles and pathway programs as well.
Fantastic, thank you. I am going to move the conversation a little bit further, just because I want to make sure that we have some time to address the Q&A. But one of the big buckets that we talked about as a group was, technology and driving outcomes. So, there are a number of ways in which we're all working to advance health equity. And as we know, technology is the great equalizer and can be an extremely effective tool to level the playing ground. And so I'd love to learn, how are you and your organizations leveraging technology to drive improved outcomes and reduce health inequities? And Samira, I'd love to start with you.
Absolutely. I think it's important to keep the end in mind here when looking to reduce health inequality. The end goal is that all patients look to have improved health outcomes across all disease areas. And technology can really be helpful in giving a local understanding of what patients tackle, both from their intrinsic factors that comprise them, so your genetics, your biology, and also those extrinsic factors that look to shape their reality, those social determinants of health, like the places they live, work, play, worship, and so forth. Really looking to integrate both the DNA as well as the ZNA of a patient when addressing how best to improve a patient's health outcomes. We can work to improve those social determinants of health, which we know serve as quite a main driver for determining how well patients receive and respond to treatments and are managed for their disease states of interest. For this reason, we really look to leverage technology and startups to figure out how to go about, for instance, clinical trial design. Startups can help this process, ultimately increasing access faster and more robustly, and also build upon kind of some of the frameworks that we've already constructed internally. And digital technologies can really work to serve as enablers in this respect, both in identifying the population of interest and also in discovering where they exist and creating far better reach when what we may have been available prior or in the past. So that's kind of the way that we utilize technology to kind of integrate best practices.
Great, thank you. And Keith, how are you in Hartford Healthcare leveraging these technologies?
I mean, and then a lot of this, right?
Yeah,
So Dr. Barry Stein is our Chief Innovation Officer, and I can tell you he has a belief that it's very important for us to look at technology in many ways, right? And one of those ways is to get to a level playing field in the conversation of equity. It's also in an appreciation that healthcare has to change, right? Healthcare, the cost of healthcare is exponential. So healthcare, how it's delivered, has to change. And so we've partnered with the leadership of Barry Stein, we've partnered with companies such as yourself we've identified and supported a number of startups, to include the company that I spoke about a few minutes ago. We're in helping to say, this is a problem that we identify. In fact, we've worked with company to help us identify certain problems. This is a problem we've identified. And as Dr. Stein always say, what's the primary problem and how can we approach it with a solution? There was a time when the technology platform, it was almost separate from the innovation that exists within healthcare. So healthcare exists, you have innovation, but the merger is very, very important. And that's a pivotal part of what we see as the future of Hartford Healthcare. I'll give you a quick example, telehealth. So a platform that's been available for years, right? Obviously, there's regulations that has prevented institutions from moving that forward. Some of those regulations were eased up just a little bit over the last few years due to the fact that we need to reach people during the height of COVID-19. These are individuals not just with COVID, the COVID-19 disease, but also with other health issues. We saw over 700,000 patients leveraging that platform. A lot of these patients are patients that are completely new to our system. And even more, a lot of them are new to generally accessing healthcare. So we've, the plan obviously is to work with the innovation team and innovations team across the state to try to leverage how we can work with these companies, how we can add healthcare to it, how we can appreciate the needs in the community, put those together and hope for a better future.
Great, thank you. And Julie, I'm going to wrap it up with you.
I would just underscore everything Keith and Samira said, and just offer that as we look to the future, right, where I think technology is absolutely going to play a much bigger role in terms of how we reach people and really get on the front end of health and well-being in our communities. But it's really through technology, the kind of analytics that we need as we're developing maybe new programs to address access around health equity, making sure that we have the technology in place to actually help us analyze and understand, is it working, or where we may need to pivot and try something else or put the pedal down. But also how technology, and this is where we are looking for more partners in innovation, is how technology can really be the key in helping us break down the barriers, right? Whether it's access, it's transportation, concierge, follow-up, as we think about that, but also as importantly, education. And we talk a lot about technology and digital literacy, but if people don't really know how to use this, for example, as a powerful partner in managing their own health, it's not going to work. So
absolutely, thank you so much. This has been an absolutely fantastic conversation, and I know we're a little bit short on time for the Q&A, but I did want to ask you all one question. There was one question that came here from the audience. Do you see any of the largest tech companies playing a role in solving health equity, and which ones come to top of mind for each of you?
I would say absolutely, and I hope or suspect some of them are on this line. But I think that they have a unique and unprecedented and timely opportunity to partner with us, to be part of that solution, to invest philanthropically, to help ensure that while we may have all these great ideas and innovation and technology, if we're not putting it to work in the communities for the people who otherwise wouldn't have access to it, we're not going to solve these challenges. Absolutely, I'd say Microsoft, Google, Amazon, Apple. I know those are kind of the household names, but absolutely, and even smaller tech companies, they all have a play a role, and we can't do it without them.
Yeah, amazing.
I think one of the things, if you look at innovation itself, right? So over the last, I'd say 10 years, the biggest innovations we've seen hasn't come out of our health systems, right? And some of the biggest companies we have in this country are our health systems, right? So Wellstar, Yale's, Hartford Healthcare, these are huge companies. So healthcare itself and innovation haven't really partnered as well as it should. And when you think what the end goal should be for better, longer life, yeah, I think we owe it to everyone, our future generation, to ensure that the innovation that is being fruitful in other industries and the healthcare industry needs to be in the healthcare industry as well.
Great, thank you. And Samira?
And just from my end, just to avoid tooting the horn of any of our competitors, I would say that collectively as an industry, there's opportunities to serve in coalitions, to serve in partnership, to really bring this forth in an accelerated manner across all patient populations. I think digital technologies are definitely the way of the future, and we want to look to enhance the patient experience in all parts of the patient journey. So that's definitely something we'll look forward to.
Got it. Thank you. I know we're right at time for our Q&A, and I really appreciate the audience engagement. I see we have 13 other questions in this chat, and I wish we had time for all of them. But I invite each of our panelists to stick around for a little bit and type those answers accordingly. But ultimately, I'd just love to say thank you to each of our panelists for such an incredible discussion. And it's amazing what each of you and your organizations are doing to improve health equity for the people in your communities. And honestly, I can't wait to continue this conversation. It's one that, the one that we must continue to have.
Absolutely.
Yes.
Absolutely. And, partnerships, very important. So, we've actually started a conversation with WellStar regarding our sepsis program a few months ago. And I expect, Julie and myself will have more conversation as to how we can continue to lead this specific initiatives as two great systems across our states.
Fantastic. Well, thank you all. I really appreciate it. And we're so thankful to have each of you here today.
Awesome.
Thanks, Nathan.
Thank you.
Thank you, guys.
So now, I'm very excited now that we are going to transition to our startup presentations with Kaizen Health and Live Chair Health. So today, each startup will present for 5 minutes, and we will have about 2 to 3 minutes for live Q&A. So please feel free to submit your questions throughout the presentations, and I will do my best to make sure that we address them. And then lastly, after every presentation, a poll will pop up on your screen asking if you'd like an introduction to the presenting startup. So stay tuned for that. Ultimately, let's get going. So first, I would like to introduce Kaizen Health and CEO Mindy Nebel. Kaizen Health is improving access, quality, satisfaction, and efficiency in healthcare by removing transportation as a barrier. Top healthcare delivery systems, payers, senior living, clinical trial organizations, and municipalities are utilizing Kaizen Health's technology and transportation network to address the social determinants of health within and outside of healthcare to promote better health equality. Or equity, excuse me. So Mindy, I'm going to ask you to turn on your camera and join us today.
It says that I cannot turn my camera on because the host has stopped it.
There we go. That should fix it.
There we are.
Thank you. So I'm going to turn over to you, and feel free to share your screen, and we'll hop into your presentation.
Perfect. Can you all see my screen?
Yes, we can.
Awesome. Hi, everybody. My name is Mindy Kniebel, and I'm the founder and CEO of Kaizen Health. Kaizen's been around for about 6 years now, and we're really working to remove transportation as a barrier to living a healthy life. And that is a very broad statement. Started the company because my own family struggled with this in many ways, but due to our time limitation, I'll leave that story for another day. I don't think it's any secret to anyone here that a lack of transportation can have a devastating effect on health and healthcare economics. Missed appointments alone costs our country $150 billion every year, 25% of which is attributable to a lack of transportation. So why do we have this problem? Well, we've got these legacy brokers that have really antiquated ordering processes that are super time consuming. There's no lack of visibility to actually what is going on when a trip is ordered to the completion of the trip. And then also there's a lack of transparency when it comes to any information about the trip, including pricing and other metrics. As was mentioned, Kaizen Health works across a whole broad spectrum of folks. So we cut our teeth with health systems and clinics. We work with Medicaid, Medicare Advantage, DSNP. We do clinical trial work, senior living, home health. So actually moving clinicians into the home. We work with nonprofits, K-12 schools and municipalities. And the commonality between all of these different groups is that they all serve a diverse population, and they all need one place to manage transportation for that population. So there's really two sides to Kaizen. We build a network and then we build technology to power it. So our network is everything from your rideshare companies and taxis, wheelchair accessible vehicles, vehicles with car seats for children, medivans, non-emergency ambulances, courier and delivery services. And we have long worked sort of outside of the justice system, but we're actually even going to be working inside of the justice system as well, starting next month. So we'll actually even have sort of prisoner transport. So that's about 30 different types of transportation all in all. And we build that up according to each of our clients' needs. A little bit about the technology. So we're all about equity here at Kaizen. So, technology is great, it helps, but it's never going to be the whole solution. So to utilize transportation through Kaizen, health systems or clinics or members at a health plan, care coordinators at a health plan, care coordinators at a pharmacy trial, anyone could be using the platform to actually schedule their transportation, but that doesn't work for everyone. So, members at a health plan can also pick up the phone and give us a call. They can use a web app, a mobile app. I'm actually excited. I sent this slide over yesterday, but it's already slightly outdated. We're actually currently in the process of updating all the languages that we can offer. So not only are we meeting people where they prefer from a technology standpoint, but also in the language that they prefer to be communicated in. And I just found out this morning that we will not be able to do 57 languages, but 64 languages all in all. So very excited about that. That's been a big mission of mine for a long time. I want to talk to you about two interesting things that we've worked on. So there's a program called Rides for Baby that we worked with Molina and CareSource in Ohio State and the city of Columbus, Ohio, to reduce infant mortality. So they had in Franklin County there the highest rate of infant mortality in the United States. And when they hired Sidewalk Labs, one of Google's consulting companies, to really dig into why, they determined that it was really a lack of transportation to prenatal, postnatal appointments, and a lack of access to fresh food. But these women actually had a transportation benefit inside of their Medicaid program, but it just didn't fit into their lives. So we worked from the ground up to completely redesign the entire benefit. And so these women had access to a web app, a mobile app. So long as they were connecting to one of their pre-approved locations, and the different categories of those locations are healthcare providers, pharmacies, grocery stores, farmers markets, food banks, and then social services or CBOs. They could be picked up at work, go to their provider and go home. And they were held to the same trip limit and mileage limit as, the typical Medicaid plan, but we actually made this program fit into their lives. And throughout this program, we saw that many women utilize transportation to get much more pre and postnatal care, as well as access to food, than their counterparts that went through the sort of typical system. And then the other part that I'm super excited to be working on currently is while we've long participated in clinical trials, we're actually going to be starting a new trial transporting tissue. So we've been asked to transport organs before, haven't quite got to that point, but we will start transporting breast milk from mothers at home to babies in the NICU. So technically breast milk qualifies as tissue. So this is kind of our first step into that space. We can transport food and pharmaceuticals and, DME and things like that. But this is a new step, and I'm super excited because it'll maintain the chain of custody from mom to baby, and will really involve the healthcare system, the health plan, and a full trial to wrap this all together. So really bringing the whole community together to make this work. And with that, I will open up for a question or two.
Awesome. Thank you so much, Mindy. And, there was one question that came from the audience, and it says, are patients re-engaging with the platform and using rides multiple times throughout the year?
They are. Every health plan has a very, very, very different setup, but yes, we have a lot of high utilizers, as you might expect. It really depends on, if somebody is a dialysis patient and needs dialysis on an ongoing basis indefinitely, and they don't have other transportation, they're going to be using it 3 times a week, if they're not getting dialysis at home, right? And then you have things like, pregnancies, or maybe somebody has a cardiac event and they might use transportation for a while and then they don't need it anymore, right? Once they've sort of surpassed that. But yes, you generally have your recurring therapies that use it quite a lot.
Awesome, thank you. Unfortunately, we don't have time for more questions, but I just want to say thank you so much, Mindy, for your time today and telling us a little bit more about Kaizen Health. And for those in the crowd, there's a poll out here, and if you'd like an introduction to Mindy, we will be sure to facilitate that introduction. So thank you again so much. All right, so now we are going to. I'd like to introduce LiveChair Health and CEO Andrew Suggs. So LiveChair Health is championing an assertive strategy to support African-American men and women's long-term health and bridging health disparities in these communities within new markets. So the company partners with community-based organizations to help health plans and systems engage with underserved peoples by meeting them at key gathering points. And so in these community spaces, LiveChair Health is conducting health screenings and links residents with health services that they often cannot go without. So Andrew, I'd love to bring you on board and hand over the floor to you.
Hello, everyone. Thanks for having me, Nathan, and very excited to present the LiveChair Health product. So let me share screen. And all right, I can't see any your face, Nathan. We're good. Okay,
great. Thank you.
Outstanding. Well, hello, everyone. My name is Andrew Suggs, and I am the founder and CEO of LiveChair Health, where we are engaging, accessing, and influencing patients to better health through awareness and navigation at community hubs, as you saw, barbershops and salons, but we've expanded beyond just those venues. Essentially, what we like to say, or our mantra is where people rest their heads, their places of employment, and venues where fun happens. That's where we set up operations. So I won't belabor this slide, as the population on this webinar is well aware of these issues that impact underserved communities, and more poignantly, ethnic minorities in particular. And so, what LiveChair Health is doing to address that is we've built and solved this problem of our high touch model by augmenting it with technology to scale the boots on the ground and human touch efforts. So as an example, when patients receive rewards, they're able to leverage our mobile wallet feature, where they can pay their barber or stylist or grooming professional directly, mitigating the back and forth and the onerous process to submit documentation to activate rewards. So leveraging the high touch model with humans that we have with technology is what we've built. And so just to kind of simplify what I said, by partnering with trusted community pillars such as barbershop, salons, community centers, housing developments, we reach people where they live, work, and play. And then after accessing those members through a health screening, or whether it's a health risk assessment, we then deploy this kind of longitudinal intervention and activate members via care management or for care management, gap closures, and specifically social determinants of health needs. All right, and so just to outline how it actually works, we primarily do this today, this engagement model, through addressing health needs via our health risk assessment that we have at our community hubs and our field team that activates members in the communities. And then one of the first steps that we want to ensure is that every person is connected to a PCP. So we have a high focus on increased PCP utilization, because we fundamentally believe that if we increase PCP utilization and build that relationship with the primary care providers, that we can see some of this the ER abatement. And then more importantly, engaging and accessing these community members in a non-sterile, kind of culturally relevant way that gets them galvanized to take those next steps in their health. So how has this worked in practice? So we've had partnerships with the managed care organizations and health systems So specifically in Group and Maryland, our task was to conduct health risk assessments and then chronic disease education and then PCP utilization from those events. And so as you see on the right hand, of this slide, we are at 100% to go in terms of connecting the members that we were responsible for to, a PCP. And not only did we successfully, hit our goal of connecting over 100% of the members to a PCP, but the time frame in which we did that was less than 33 days, which, obviously I'm biased, but I think that's a phenomenal output. Providence Health in LA. So our task was to, again, conduct health risk assessments because we really do, I think, that well. PCP utilization and addressing social needs is our kind of three primary services. And then also increasing blood pressure screenings, specifically in South LA. So at our community hubs where we engaged about 45% of the patients, we conducted out of that 45%, 90% agreed to, get their blood pressure checked. And we're actually working on now the integration of that data so that as we're doing things in the community and at these various hubs, we can have a channel where this data is getting loaded into the EHR, and then nurses, depending on the level or the blood pressure spits out, we can make these real-time interventions. And then lastly, LifeBridge Health. So we work with LifeBridge Health in Baltimore, West Baltimore specifically. And so we had a 60% HRA completion rate at our hubs. And then also about 42% of the patients that indicated needing a primary care provider, we were able to connect them with a LifeBridge Health provider. So just some of the tangible results of the work that we're doing with health systems and health plans. And so with that, I will pause. I think that puts me at about 5 minutes and take any questions that have come up.
Yeah, fantastic. And thank you so much, Andrew. So the first question, just a quick question for you. So what is the biggest challenge for Live Chair Health when you are setting up in a new community?
That's a great question. I think the biggest challenge for Live Chair Health when we're setting up in a new community is not having a relationship with all the health plans and health systems. Because you think about it, right? When we are at let's say a barbershop or a community center, there's not one specific health plan members that go into a certain shop, right? You have members or patrons across the healthcare spectrum from a health plan and health system standpoint. And so I think that's the challenging part with the boots on the ground model, is that if we're going to set up at a community venue, we really need to have buy-in from all the payers, because we're engaging every single payer member. So I'd say that's the challenging part. But some of the things that we've done on a digital front has allowed us to kind of kick that can down the road while still showing results.
Awesome. Well, thank you so much, Andrew. And unfortunately, that's all the time that we have for Q&A today, but I really appreciate your time and really appreciate the presentation for Kaizen, or excuse me, for Live Chair Health. My fault.
No worries. Thanks.
So now before we wrap up, I'd love to share a special announcement with all of you in the audience. So we are extremely excited to announce and invite you all to our inaugural Plug and Play and Hartford Health Equity Accelerator Expo on September 29th in Hartford, Connecticut. So over the last 7 months, Plug and Play has joined forces with program partners Launch, Hartford Healthcare, Trinity College, and CT Next to discover cutting-edge digital solutions that can have a meaningful impact on improving the delivery of care, patient experience and outcomes, and enhance the health startup ecosystem in Silicon Valley, the Hartford region, and beyond. So we're pleased to showcase 5 startups within the health equity field that will showcase how they're advancing healthcare and improving health equity by addressing social determinants of health, expanding access to healthcare, and bridging the digital divide. So a registration link will pop up in the chat now if you'd like to join us. And if you have any questions or would like to learn more about what we're doing at Health Equity, please do not hesitate to reach out to me and ask. And with that, I'd like to thank you all for attending our Advancing Health Equity event. Excuse me. It's so vital to continue having these conversations and presentations like these, as there's so much still so much more that can be done to improve health equity in our communities. And as now a final poll will pop up to ask you 2 questions about today's session, please take a few seconds to submit your responses. And Lastly, if you have any additional questions about Plug and Play and our health equity initiatives, please do not hesitate to contact our team. So thank you all and have a great rest of the day. Bye, everyone.